Welcome to Verified RX, your prescription for success. Brought to you by the Vizient Center for Pharmacy Practice Excellence.
Hi, everybody, and welcome. I am Katie Korte, and I am your host today for the Verified RX podcast. I am so excited about what we're talking about today. We're jumping into an incredibly important topic around drug shortages, but specifically the newly released results that we have from the Vizient's 2024 drug shortage report. Before we get into this incredibly important topic, I want to introduce my friends and my colleagues, Niko and Kyle, and we're going to have some fun today talking about this topic and the incredible work that we've been doing behind the scenes. So before we jump in, Kyle, Niko, introduce yourselves to our listeners.
Yeah, hi everybody, and glad to be back on the podcast. My name is Kyle Hoelting, Director of Pharmacy Supply Assurance and Stewardship here at Vizient. Great to be back, Katie, and I'll turn it over to you, Niko.
My name is Nikola Markoski. I go by Niko for short. I am the Director over Pharmacy Sourcing Strategic Solutions and Analytics. Thanks for having me today. I'm really looking forward to this.
Great. Thank you both. Excited that you're both here today to talk about this very important topic and what really impacts our daily work. Kyle, I want to start with you today. Can you set the stage for our listeners? They may or may not be aware that we actually had a survey that we conducted in 2019. We now have some new results from a survey from 2024. I would love for you to highlight what's different about this year's survey and what made 2023 such a critical year in the drug shortage landscape.
To rewind us back to 2019, the key takeaways from that report were in that initial survey, the results showed that there was an additional $359 million in additional labor costs associated with drug shortages, as well as 8.6 million hours of added labor at our hospitals and health systems. Jumping forward to our 2024 report, the survey data is essentially January 2023 to December 2023. We sent out the survey in 2024. Niko will go into that more in depth. 2023 is our year of focus for this report. There's two big changes from the 2019 data to our 2023 and 2024 report. First being the pandemic. During the pandemic, there was much more attention on drug shortages. We became much better at tracking, trending the number of active shortages, the number of new shortages within our institutions, the number of electronic medical record changes, the duration of these shortages, the added labor associated with them. So it's much easier to respond to the survey questions and get to detailed information that we might not have had in the past. The second piece is, let's just take a look at 2023. If you remember, Q1 of 2024 was ASHP's highest number of active shortages in the US of record. That was 323. That was Q1 of 2024. That tells you a lot was going on in 2023. It was certainly an anomalous year. There are three big sentinel events or events which had impact on the national supply chains. In no particular order, there were significant oncology shortages. One of the manufacturers temporarily paused production at their facility to respond to an FDA inspection. That affected a number of oncology agents, and our hospitals and health systems spent a significant amount of time working through those shortages. The second was the Acorn closure. Acorn left the market in 2023. So we all showed up to work one day and we got the notification that 100 products would no longer be available on the market. Those 100 products accounted for over 200 NDCs. So as you can imagine, there was a lot of movement, adjusting, understanding the impact, and dedicating time to managing and mitigating the exiting of that company. And lastly was the Rocky Mount tornado. A facility was impacted by a tornado in North Carolina. The facility had to be temporarily closed while it was cleaned up. FDA had to come back in and reinspect, make sure everything was still within our quality control measures. And so those three big sentinel events ate up a lot of our time. It took significant resources, financial, as well as time and clinical expertise to manage these. That is what differentiates us from the 2019 report to now.
I spent about the first 10 years of my career in health system pharmacy. And I can tell you that it wasn't until about 2019 and then moving into the pandemic years where we were tracking time and cost associated with shortages and the impact there. So, Niko, give us a lay of the land. When you look at the survey, how was the data collected? What did the mix of information really tell us? And from your perspective, what were the biggest insights or patterns that surfaced from this year's survey?
The hidden cost of drug shortages is what we were really after. To dive into some of the methodology, the survey itself, the data collection period, happened from April to September of 2024. And the focus was fostering information and day-to-day operations of drug shortage mitigation from the time period of January through December of 2023. With that, we had 132 responses in total, representing a mix of health systems, medical centers, pediatric facilities, and ranging from small to large-sized hospitals serving both as critical access hospitals all the way to specialized hospitals and then the ambulatory care facilities. When we look at the mix itself from our respondents, 73% represent an individual facility, while 20% of the responses we gained represent the actual health system perspectives. And the interesting breakdown of this was the findings show that on average, sites on a day-to-day basis from that time period, so 2023 is what we're focusing on, are monitoring 43 ongoing shortages during any given day, with a maximum of monitoring 70 shortages on a day-to-day basis at any given time. And what's even more interesting is that pediatric facilities, arguably some of our most vulnerable patient populations, those facilities are actually monitoring 25% more shortages than a general adult hospital or general typical setting. Going into how this compares to the 2019 survey, Kyle hit on some pretty astounding numbers for the 2019 survey. But what does it actually mean? In 2024, what we found out is that 74% of all facilities are reporting going over budget. And that equates to a whopping $894 million annualized in additional costs attributed to drug shortages. And that equates to a totality of 20.2 million annual additional labor hours in managing, mitigating, or just responding to drug shortages. Those numbers are quite staggering and a call to action to the general industry. And if you look at the report itself, something that we did different this year is we asked a few questions on what it means to properly mitigate a shortage, maybe additional areas where drug shortage procurement is coming from, whether the secondary market or typically referred to as the gray market, and then specifically what classes of drugs are highest concern or took the most amount of time. If I look at even just the top class of drugs that had the biggest impact, antineoplastics, benzodiazepines, local anesthetics, opioids, even just those top 4 categories, these are essential medications. These are critical drugs to day-to-day operations. Not only are the numbers staggering, but the insights are staggering. And the main takeaway here is that drug shortages are not isolated events. It's a day-to-day operational impact that we need to work together as an entire industry to be able to combat.
Wow, those numbers are staggering, Niko, and they don't surprise me. And as we see over time, when you look at the 2019 results that we had and the increases in numbers that we see today, the sophistication of our health systems, the increase in awareness, and the ability to track and understand what we're tracking lends to those results. Let's break down what you all see that's working. What has Vizient built or enabled that has made a difference in this space?
The goal for us here at Vizient is to be your trusted partner. We want to give you timely, actionable information with the appropriate context. A good chunk of shortages, if you're in that world, a lot of it is sifting through the rumor mill. What's happening today? What do we need to work on? Versus this may be happening, but we're unsure today. That's been our focus. How do we enhance or add to what you're already doing today? We've talked a lot about proactive versus reactive. We've recently published a lot of really great resources that will allow you to build out that proactive piece of your shortage management. If you haven't already, I would really encourage you to take a look at the AJHP article specific to drug shortage stewardship. Drug shortage stewardship entails having the appropriate inventory and mitigation practices in place to respond to a shortage that's affecting everyone at a national level. Thinking through those drug shortage stewardship principles, what does appropriate protective purchasing look like at your institution versus inappropriate. Take a look at those principles. The next proactive thing I would encourage you to do is take a look at our drug shortage KPI white paper. In order to get the financial resources to manage shortages at our institutions, we need to provide objective data to our C-suite as well as our pharmacy leadership, and tracking of those KPIs will allow you to do that. Additionally, taking a look at the essential medications list, we've added some new components, specifically the market resiliency score. This will allow you to demand plans specific to your institution, take a look at the market from that national level to understand where there may be gaps within your inventory procurement practices and potentially need for additional safety stock. Thinking through the reactive, within Vizient, we have our shortage surveillance and readiness team. Our goal is surveillance, assessment, action. We're putting together those supply chain disruption reports, those webinars for those sentinel events that do occur. We have our member drug shortage mitigation group. This group is made up of 11 health systems across the nation. So this is basically you all. You help us decide what mitigation strategies are needed, peer review them to make sure that they make sense clinically and operationally, and then get those out in a timely manner when you need them. There's a lot of work that Niko's doing that I'd like him to touch on as well. Please take a look at those resources. To be prepared for a shortage tomorrow, you need to start today, and those are all great resources to help you get started.
From a Vizient perspective, what we're doing at the individual level across the industry, so what Vizient's doing today, is we're taking a more data objective approach. And one of the tools that Kyle alluded to, the Vizient Market Resiliency Score, in the essential medications list is critical because it points out one of the highest impact things that anyone can do across the industry, and that's demand planning. We are partnering more from a sourcing perspective with manufacturers, with suppliers, with distributors, with wholesalers, analyzing the ecosystem, working on more proactive demand planning, and working on fortifying those gaps that we've identified within resiliency that exists in the current supply chain.
I'm happy to see that hospitals are more prepared. The tools are getting stronger. The collaboration across the industry is creating real progress. While we still have work to do, there is a path forward, and it's about building our smarter systems and sharing knowledge and really staying ahead.
Katie, let me kick a question to you because I know you're in the weeds with Niko and I every day as well. When an active shortage occurs, when there's a deficit of product on the market, there are two solutions. Your first is implementing mitigation strategies that can be conserving product or using an alternative. That's not always possible. The second is committed contracts to ensure that product is available when you need it. You are involved in that committed program space. Is there anything that you'd like to speak specifically to that?
We have the Vizient Reserve program today, which started back in 2019 through our Nova Plus Enhanced Supply program, and it's evolved over time, and we're now expanded outside of pharmacy into different med-surg categories, driving that resiliency into all essential products within the health system. The key to the program is to have all the stakeholders at the table, health systems, suppliers, and Vizient, to ensure that as we drive commitment to these specific suppliers, those suppliers are actually showing up differently. They're showing up and creating additional inventory. They're storing inventory on U.S. soil stateside. So when the disruption happens, that inventory is already here and ready to be used. And we're avoiding that surge in cost and gray market prices because you have that inventory at the contracted price for that committed contract. As health systems look at their overall resiliency plan, I always say there's so many levers that you have to have in place. What you both have been talking about today. You have to have some analytics in place. You have to think about proactively setting up your drug shortage response teams and your mitigation strategies, but you also have to have an inventory strategy. To use a program like the Vizient Reserve program, where you can rely on net new inventory being stateside, makes a huge difference. When there's already a deficit in the market, when there's a true shortage happening, a perfect example of how the Reserve program has played out and shown to be successful was through the 2023 carboplatin shortage. We saw a period of time there where there was a deficit of hundreds of thousands of doses of carboplatin. The health systems who were already participating in the reserve program, they were already committed to those suppliers and driving additional inventory into the market. They were able to access inventory throughout the duration of the shortage, continue patient care, continue giving their patients the infusions of the medication that was the first line therapy, which is what we all care about. We care about evidence-based medicine and ensuring that our patients, our families, our friends are getting the care that they deserve. They were able to continue that, and they had that peace of mind throughout that shortage that they would have inventory. Thank you again, Kyle and Niko, for your insights today, and for everyone who is listening in. Thank you for the work that you're doing every single day to take care of patients and ensure that we are providing the highest level care for each of those patients coming into our health systems.
Join us for more Verified RX podcasts. Subscribe today. Like us. Send us your comments. We'd love to hear from you. Verified RX is a prescription for success and is brought to you by the Vizient Center for Pharmacy Practice Excellence. Thanks for listening.